We recently got back from a much needed vacation visiting family and friends in India. I thought this would be a good time to talk about the differences in dialysis treatments in these two countries. In India, medicine is still socialized, which means government pays for most of the medical expenses. However, there is a big chunk of privately paid insurance, privately paid healthcare by the patients and their families. And nowadays, there is a mix of healthcare insurance purchased by the patients, their families, or available to you through your employment. In the United States, most of the medical expenses are incurred by insurance companies, which are the private payers, or the government-run health insurances such as Medicare and Medicaid. In India, when a patient is in need of dialysis, their nephrologist prescribes this to them. Depending on what the social status or the financial situation of the patient is, these treatments will then be decided by the patient and their families. If they have private insurance, then sure, they will get 3 times a week dialysis as prescribed. If the patient has financial backup, resources to take care of their dialysis treatments, then they will do so by paying cash for dialysis. But in such situations, if they run out of cash, then unfortunately people stop taking dialysis even though it is needed for them. Sometimes if they have good health insurance provided by either themselves or by their employers, then they will cover dialysis for the patients. In the United States, when dialysis is prescribed to a patient, they automatically get 3 times a week dialysis, which is paid for by their insurance companies, Medicare or Medicaid. There is no financial barrier as such to getting dialysis. Dialysis can be done at home, like you all know, or in the center. In India, dialysis units are not freestanding units. They are some portion of big hospitals that have been created or made into dialysis units, where patients who are acutely ill or soon after their acute illness can go to get dialysis. In the United States, however, you see dialysis units which are freestanding dialysis providers all over the country, even in the smallest of towns. In India, access to dialysis treatments, going to these big hospitals, units, travel from rural areas, access to nephrologists is still a big issue. In the United States, even though transport to and from dialysis is a small issue, however, dialysis unit accessibility into small towns, rural counties is much more common. In India, kidney transplants are usually are present, but they are not very readily accessible. In the United States, for all eligible patients or end-stage kidney disease individuals, they go through a rigorous process of being evaluated for kidney transplants, and if they are eligible, they get put on a kidney transplant wait list. In India, dialysis, unfortunately, due to the cost and accessibility, has become more or less an acute treatment modality, meaning if the patient has acute kidney failure in the hospitals, then they get dialysis while they are either admitted to the hospitals or soon thereafter. In United States, dialysis treatments are more chronic and ongoing, and we see many people on dialysis for multiple years together. So these are few differences between the two countries and the dialysis treatments as I see from my perspective. I hope this was helpful to you.